common question that I get often is, how do we sleep when we have sciatica? So first of all, it's important to understand that this S shape that you see here, approximately, it's not quite perfect, but it represents what I would call a neutral spine. This is when you're standing comfortably straight, you have this shape in your spine. And in particular, the low back has this C shape. So the goal, whether you have sciatica or not, is really to maintain this neutral spine at all costs, at any cost. And when you have sciatica, this is especially important. But sometimes when the sciatica is very severe, you may need to deviate a little bit from that neutral posture. So first of all, sleeping on your back or your side in that neutral posture is always the key. Try not to bend your knees up too much, because that will start to flex your spine like this. But with sciatica, that little bit of flexion can make the difference between feeling much more comfortable and having a very uncomfortable night. So because as you can see, that hole where the nerve comes out of, when you bend a little bit forward, or if you bring your legs up a little bit, that space for the nerve will open up. And that's where the pressure is by the disc from your sciatica. So sleeping a little bit with a bent spine, you can accomplish this by laying on your back and then having your legs up on some dunar or pillows. You can accomplish that by creating a gentle fetal position bend, either by bending your torso or by bending your knees up. The trick is to do it minimally. Do the minimum bending that gives you enough relief to sleep. Because when you bend forward, this is what I advise all my patients not to do. When you bend forward, you compress the disc, and that creates problems later. So you want to use these postures minimally, just enough to get comfortable to make it through the night. And then you can follow up with other advice and activities that will help reduce the sciatica during the day. But this video is specifically about sleeping with sciatica. If you have any other questions or need any clarification on what I've said, please feel free to make some comments below and I'll do my best to answer them.